big question for you is, what will you choose to challenge? It's about saying no more. Stop. That is not cool. Is what will you choose to challenge? We might not be able to fight every single bias, but if we all choose just one challenge, our chances will grow.
What type are you? What entices you? What stands out for you? What stands for you? Might not think it's you, but it's precisely you. When they see something off, and you're gonna stop when it all comes down to you. Never begin to dissolve this. Woman, I hold the population, note this. But they only can see 10% of the world's income consulting. If you don't speak up, you condone this. I shouldn't really have to approach this, but it's well with the monogamy, so to speak. We should stick up for each other to resolve this. Super steps, all of this starts with you and me. This I mean, you and me. Pull out the bias and you will see. Celebrate women's achievements, so she be seen. For an inclusive world, you be key. I said you be key. For your sisters and cousins, you be key. For your mother and auntie, you be key. For the unity, choose to challenge for the community. I choose to challenge, choose to challenge,
Is
choose
what
to
will
challenge,
you
choose to challenge, choose
We
to
might not
challenge,
be able to fight every single bias, but if we all choose one challenge, our chances will grow.
That's what's hot. I'm for those of you left with top. So when I hold it down for bosses and then I'll keep down on top. Time to stop paving ways. Show the world what you got. Tell them yeah, this way I can bring inequality to a stop. Are you listening? Is it sinking in? Are you permitting it? Are you standing up? Are you seeing it? On the internet? Are you clicking it? Are you nipping it? When you witness inequality, dismiss them, or you letting them. By admitting this, you're getting things on the right path, playing the right path. To that evolution, with your contribution, we can cut out exclusion. That's a woman's solution. Involves us confusing, involves us introducing. Unlearning, we are not equal, so tell me what side are you choosing? I choose to challenge, choose to challenge,
Is
choose
what
to
will
challenge,
you
choose to challenge, choose
We
to
might not
challenge,
be able to
choose to
fight
challenge,
every
choose to
single
challenge,
bias, but
choose
if
to
we all
challenge,
choose
choose
just
to
one
challenge, choose to
challenge,
challenge,
our
choose to challenge, choose to. That's what's hot. I'm for those of you left with top. So when I hold it down for bosses and then I'll keep down on top. Time to stop paving ways. Show the world what you got. Tell them yeah, this way I can bring inequality to a stop. Choose to challenge.
Woo, so I hope everyone got pumped with that song. That was, by the way, the International Women's Day official song for 2021. So welcome to all of you. We are so excited that so many of you have gathered today at our International Women's Day event. My name is Tatiana, co-founder, project leader for Empowering Women in Health, and here is the breakdown of how today is going to look like. So we will start with a brief introduction of the organizers of today's event. Then Dr. Pillai Riddell will give a keynote presentation, followed by a conversation with 3 incredible panelists that will be able to join us today. We will then invite all of you to test your knowledge and continue the conversation with a few interactive activities. And finally, at the very end, we'll reveal our new project lunch where you will be able to take the challenge and take action as well. Note that at some point we will be taking a photo for promotional purposes, but you can be sure that we will provide you with a heads up right before we do it so that you can take off your camera and change your name if you should choose to do so for privacy reasons. Until then, we welcome everyone, if you can, of course, to turn your cameras on. Today's event will be recorded, but only the panelists and our moderators will actually be filmed, so rest assured. On another note, everyone here that registered will be automatically entered into a draw for a special prize that we will be giving out, so the winner will be contacted by the end of the weekend. As for housekeeping rules, note that we will be muting everyone for the sake of auditory clarity, but during the panelist discussions, we'll have a brief Q&A at the end where we will welcome input from the audience, and at that point, you will be invited to raise your hand with the button indicated there on screen so that we can pick you so that you can ask your question. Now I'll pass it on to Sarah, Global Peer Student Lead for York International and the Global Peer Program. Take it away, Sarah.
Thank you, Tatiana. I'm very excited to be here today. I'm here from the Global Peer Program at York International with Christine and my colleague, Al. The Global Peer Program is a program designed to help new international students during their transition to York University and their life at Toronto. We connect them with upper year students who are called peer mentors, and hopefully that will help them get settled in Canada. There's opportunities to become a peer mentor, so we encourage everyone who are not even international students to become a peer mentor and support incoming students with information and resources about York University. You'll also benefit from the opportunity to participate in events organized by York International. Also gain leadership skills, grow your network, and as well as meet incredible number of people through our global community. And so you'll have an opportunity to connect and meet with a lot of people through this program. So I'll pass it on again to Tatiana.
Thank you, Zara. So now I'll just take a few minutes to tell you who Empowering in Health is and why it's so important to have a conversation like the one we have today. So EWIH is a recently founded grassroots organization. Our student female-run team is composed of members from diverse cultural and academic backgrounds, but we all share one common mission, and that's to change the face of Canadian healthcare to one that is equitable and representative in its leadership. We are committed to raising awareness about the current gender disparities in the field, inspiring and supporting women in their path to leadership, and encouraging the community itself to speak up. That might sound like a little abstract, so let me tell you a little bit about what we've accomplished so far. This past February, in honor of Black History Month, we reached out to 4 inspiring health leaders and interviewed them about their experiences, challenges, and advice for anyone wanting to become a leader. The interviews are currently available on our website, and transcripts with extra material will actually be posted next week. Our conversation with Dr. Esu, Dr. Baidu Bonso, Onome Ako, and Dr. Burgess gives a very human take to these leaders, making us realize that part of becoming a leader is experiencing and overcoming difficulties, as well as celebrating every success. So on the next slide, I just invite you to take a moment to just read a little bit about some of the amazing insights that these leaders provided. Now, the other thing that we're proud to have accomplished is actually something we haven't revealed to the public yet. So you're the lucky first to witness the reveal of our Canadian History Health Timeline, the first women-centric timeline collecting profiles of health pioneers, most of them Canadian, but also from all over, that have been crucial to the formation of health systems we have today, alongside some non-Canadian but prominent firsts that push forward the women's movement in the health field. These profiles include people like Dr. Janine Kidd-Trout, who in 1841 became the first female licensed physician in Canada and founder of the Women's Medical College in Kingston, Ontario. Her date of birth was actually yesterday, March 11th, which, by the way, is the first ever official Canadian Women Physicians Day to be celebrated. Now, to provide context about why this 1841 date is so shocking, let's take a look at Dr. Dotharia Extraben, who almost a century prior became the first woman in the world to receive a medical license. Now let's forward in time once more to 1917. Here, Charlotte Edith Anderson Montour graduated top of her class, making her the first Indigenous Canadian nurse to do so. She volunteered to join the Nurse Corps for work. And did she survive? Well, check out our timeline on our website to learn more. Now, did you know that we actually made history in 1983? That's right. So Dr. Roberta Bondar is the first Canadian and first woman neurologist in space. Her study on brain blood supply has been paramount to the health and safety of astronauts today. Now, these are only highlights, but I think we can all appreciate how important it is not to let accomplished women be forgotten. We can still learn so much from them, and in order to move into our future, we have to be aware of our past. The website link will be provided in the chat so that all of you can appreciate the pioneers that have shaped our today. So to go back to that question, why is it so important to have events like the one we have today? That's because regardless of gender or background, we must come together as a community and learn about our past, about our present, and only then can we hope together to overcome the challenges and barriers facing healthcare and build tomorrows we deserve. Now, today we do lack representation, we lack research centered around our health, we lack data about this problem. We're not properly and systematically represented in research and policy. We have been vastly excluded from history and prominence up to this point, but no longer. Let's rewrite the health narrative together. And speaking of leaders, I would like to introduce our keynote speaker, Dr. Rebecca Pillai Riddell. So Dr. Riddell is not only the Associate Vice President of Research at York University, she's also a world-renowned health scientist and authority figure on infant and young child pain that seeks to understand pain from a psychological, social, and biological perspective. She is the director of Opportunities to Understand Childhood Hurt Laboratory, or the OUCH Lab, where she has built the largest cohort in the world studying young child and parent interactions in vaccination over the first 5 years of life. Her awards and accomplishment would probably take the 2 hours that we have together to recite. However, I just want to point out that recently, in 2020, she was awarded the Outstanding Pain Mentorship Award from the Canadian Pain Society, and in 2019, she, along with the OUCH Lab researchers, were awarded a $1.5 million grant from all 3 federal research agencies. So without further ado, Dr. Riddell, take it away.
Thank you, Tatiana. I'll just beg for people's patience for a moment as I share screen. And I'm hoping that you can, Tatiana, you can see my screen and I can start. Okay. So I want to thank you all for coming today and for celebration of International Women's Day. It's a pleasure to be here. And Tatiana, thank you so much for the ask. Okay, so trying to, doesn't seem to be advancing. There we go. So the goals of what I hope to accomplish today, Tatiana had asked me to sort of share my journey as a health sciences research leader and offer some personal perspective of critical elements of becoming and being a leader. And so that's what I hope to accomplish. So I think I'm going to start in a very awkward place, but actually from the outside looking in. And that's the idea of, you know, the self that I project and the self that when you're applying for leadership jobs or you're applying for grants and what that looks like and how actually many people judge me in terms of and my worth and my being or my need to be a leader in terms of these sorts of categories. And so, you know, if you look at my life narrative from the outside looking in, what it looks like is that there's this, you know, long career of success. I was very fortunate, and I'd say serendipity has played a huge role in my life, where from undergraduate to my graduate work at UBC, my master's, my PhD, and then a CIHR postdoctoral fellowship, outside agencies have actually paid for tuition and my living expenses, all sorts of things to make sure that I could even, and as I became a professor, even bought out time from being, to dedicate me to being in the lab so that I could pursue my research. That continued as I became a CIHR, and that's the Canadian Institutes of Health Research. For those of you who don't know, it's our largest federal funding agency, and it's dedicated to health research. So all the way through my career, through my PhD, postdoc, new investigator years, I was very fortunate to get a boost, really, from the government that to help me create the lab that I have. When that ran out and CIHR ran out of salary awards, I was very fortunate to get a York Research Chair, grateful to the Faculty of Health, the Vice President of Research and Innovation for that, that ability. And then I took a turn in 2017 where I stepped aside from my chair, put it on hold, to become Associate Vice President Research. And so I stand before you, and it looks, on the outside that I'm a university leader in research, which I'm passionate about, and I get to be an internationally recognized health researcher. But I think that it's really important when you look at female leaders to look at the narrative from the inside looking in, especially when we try and fight imposter syndrome. And I think that I offer these sorts of points about the inside looking out to make sure that you lean in, to make sure that when you feel weak, when you feel tired, that you're not alone, and that leaders always have to face this stuff. And I put that phrase, life doesn't get easier, you just get stronger. And I think that some of these things that I've put down that I do want to talk about in detail, I didn't want to go through the accomplishments too much in detail, but these sorts of things I think are important, as some of these may intersect with your life. So, I think life was definitely difficult for me growing up. My mother was very ill and died. My father died the subsequent year. So by the time I was 18, I actually was living on my own. And so poverty and understanding that background was something that I grew up, I had to take care of myself. And so I think when we think about equity, diversity, and inclusion, they often don't talk about socioeconomic impact and intersection. I'm a woman of color, but I also came from a background that made it difficult. I did get into graduate school the first time. So for many of you who are around the table right now, you're applying to very competitive programs in the health fields, clinical psychology, medicine, physiotherapy, social work, all of these sorts of things. And I didn't get in the first time. I took it for granted. It was one of my best losses. And I'll talk more about that, but that was one of my best losses, was getting devastated after thinking, how could I not get in, and not getting in. When you look at all the awards and things, there's no place on my CV that really talks about all the failures. And so that's a really important thing when putting yourself out there, is that you don't actually put that on your resume. But my grant failure rate is about 70% or awards. So if you think about it, I lose more than 2 times the amount that I win. But I keep putting myself out there. My job application failure rate, when I'm applying for positions and jobs, is about 3%. So my success rate is 5 times almost what my success rate is. And I want to say that I struggle as a woman of color. I think that when I sit at tables and I'm the only woman is one thing, and then being the only woman of color. So particularly as a leader, I'm often called upon to represent women as a whole, represent racialization as a whole, and it's difficult. Sometimes I get overwhelmed. This has been a particularly difficult year to be a racialized person. And sometimes I have to actually back out to say, I can't comment on that, sorts of things. But it's an added pressure to being a leader that gets layered off, that we have to sort of strengthen ourselves towards, that it is worth it. And we do this not actually just for ourselves, but for the next generation, so that they actually won't have these burdens to bear. So I think this is all to say that my failures and my losses are actually what has prepared me best to be a health leader, not my successes and gains. And so as a health leader, you only see the side that looks successful, the side that looks that I've won awards, or that I've won positions and things like that. But it's not the winning of those awards that have gotten me here. It's actually the failure and picking myself up and keeping going. And when I feel that there is bias, when I feel sometimes there's a saying that, when you're a racialized woman, you have to work twice as hard or 3 times as hard to prove yourself compared to someone who isn't a racialized female, for example. And so, but in that struggle, it's made me stronger. And so I'm always careful to take my successes with a grain of salt and to really learn from my failures. And I think that that's an important part of being a woman leader. So I have some tips that I want to share that I think I've learned in my experience, now that you know who I am and kind of how I've gotten to where I am and some of the unique aspects of being a leader. I want to offer some advice to women who want to be leaders in health and anywhere. But the first one is actually to be strategic. I think we all talk about the plan B, making sure you have a plan B. I think because of the different experiences I've had, plan B has never been enough for me. I've always actually had to have a plan A, B, C, D. And when I train and work with my graduate students, I actually work with that in my lab. I'm always talking about having backups. And so one of the things I'd want to say is don't be a Jackie of all trades and a master of none. And I think that when we're starting off in our career and at different parts of our career, we actually have to remind ourselves that. So this is really about being and becoming and being a leader, is that we have to be strategic. Time is a resource that no matter what, you can't get more of. And you have to really think about being strategic. I especially feel as females, we're so collaborative. We want to get involved. We want to support, and we want to help. But there has to be a self-protective nature as we move forward, because we can't do it all. And so one of the key pieces I see in my mentorship when I mentor early career faculty, for example, or when I'm mentoring trainees, is that they're doing too much. And so it's that idea that if you really have to think about why you're picking these experiences. Now, first and foremost, if it causes you joy, do it. By all means, do it. It can't all be about just the professional, strategic, path that you want to get on. If it gives you experience in the health fields, that's an important aspect. So if you want to be a clinical psychologist, you need to think about research. If you want to be a physician, you should get some volunteer experience in clinics and understand that. But one important thing to understand is that in leadership, particularly in my leadership roles in health, both as a researcher, as a leader, and as a clinician, letters are currency. And what that means is that reference letters that someone can write about you to give you evidence about your success, evidence about your accomplishments is very important. I would argue almost as important as your accomplishments themselves is that people are noticing that, which is an odd way to think about it. And so, but it is something that I think is the reality of understanding the system as it stands today, something we want to change. So when you're doing things, make sure that you're able to have, and again, this is a secondary reason, joy and experience are important too, but really think about, is this adding to my network of reference letters? Because that's what you'll ultimately, as you transition out of where, your first applications into a graduate or a postgraduate professional program, these are sort of the things that you have to start building and diversifying. So for example, where I sit, I have about 7 or 8 letters of reference that people who will comment on for me, whether I'm taking my role as a clinician, as a clinical psychologist, whether I'm coming at something as an academic leader, as associate vice president in leadership, or if I'm applying for something like a researcher board. So you start building up, and you're early in your career, and so you want to start that process, but it's a continuing process to evolve, to make sure you see that these reference letters are currency in leadership roles. And the other thing is to be involved to lead for leadership. And that's the idea, is that making sure that you stay involved. This is when you're not spreading yourself so thin so that you're just a member of everything and never getting a chance to lead. So it's much more powerful to stay involved with things and get to a point over multiple years to lead it, or to have ideas and try and make that enter fruition. They can't always be a leader, and that's not, it's important to collaborate as well. So it's that idea of being a part of leadership teams, but also making sure that you carve some room for leadership for yourself. The other piece I want to bring up when we're talking about being strategic is to work to achieve your meta goals, and you will always be successful. And so I'll talk about meta goals right now and share what mine are, but really a meta goal is a goal above a goal. Getting into clinical psychology programs, medical school, getting into law school, those are not meta goals. I want you to actually reframe those sorts of things, or getting this award, as goals to serve a larger goal. And as long as you're always working to do things to achieve larger goals, bigger than that, you'll always be successful. So it's about really creating your metrics. And so these are my meta goals. And so that in the day-to-day, I always want to work to make my community, however that's defined, better. I've always realized that for me, having a seat at the table, so this idea of leadership, is actually something that's a part of my DNA. I'm happy to be a contributing part, but I also want to be a leader. And so for me, I always want to make sure I'm doing things that lead to that. And the third one is where I kind of have had to narrow my focus, is because I've realized that I very much like to foster a growth mentality. I very much want to fight for equity, to access opportunities for growth. And it's very much about research and teaching. So really the idea of me going into the corporate world, for me to go into different settings, I really like research and teaching in that combination. So for me, my professional goals will, for the time being, until I recreate my meta goals, will be in the university, in a university setting. So you really see how getting an award, getting into a program, any sorts of things are steps along a path, but they're not the goal to end all. I'm going to talk about, just really quickly, dedicating time for structural self-promotion. So this is the idea of not getting your pictures on Twitter and promoting yourself to every opportunity. Hi, I'm this person. Did you know I did this? But rather the structure of self-promotion. Because again, as women leaders, we don't do this enough. We don't dedicate enough time. So people talk about self-care, and I want to focus on self-promotion for a minute. So this idea I've mentioned about building a letter writing network, so a group of people, making sure you start thinking about that. These are all key components to getting to that next level. I create reference letter dossiers for people. So when someone is going to write a letter of reference, I actually spend the time to highlight for them. And I make people who I write letters for in my lab, I really model that and ask them to put together what are the highlights of their experiences in my lab. So my letters, when I write for other people, are more specific, but I do that for others as well. I spend time tracking on my CV. My CV is on my desktop, my resume. And when I do something and I'm invited to give a talk or a paper is accepted, I spend 5 seconds cutting and pasting a note into my CV. I may not have time to make it look pretty at that moment, but I'm always collecting so I know what I've done. And then I'm always looking for and accepting people who tell me, oh, you should apply for this. So I'm always open to that and making sure I spend time, not just on supporting everybody else, which I think is very important to me as a leader, but also looking for opportunities for myself. And so my final point is about diversifying your STEAM portfolio. So if I only got my esteem from being a researcher or for being associate vice president, my esteem would be in the toilet a lot of days. These are jobs that are set up for criticism, for peer review. You're always trying to build consensus. And so it's really important that you cherish the other roles. So I put this picture of my children and my husband, and my family is an important part of where I get my esteem. Being a good mother, being a good aunt. There are different roles that I hold, and I call that my esteem portfolio. So, having a really crappy day at work and coming home and having my daughter say, oh, thank you for making that, or thank you for doing that, that's important to me. And I really hold into esteem what my role of a mother is, so that when things go wrong, even when things go wrong as a mother, I have other places to draw and to get value from where my esteem can be from. So it's always about making sure there are different pieces. So in conclusion, to kind of summarize, leadership is hard, but keep fighting. Do I think you'll have to fight harder as a woman of color, as a woman with a disability? Yes, but keep fighting. Make a strategic investment, investment of efforts, and take time for structural self-promotion and diversify where you make sure there's a diversity in where you get your esteem. Thank you so much.
Thank you so much, Dr. Pillai Riddell, for sharing this enlightening speech. We learned so much from your story and advice as it inspires us for a better tomorrow. We appreciate you joining us today and supporting our project in rewriting the health narrative. We are also excited to have our panelists here today who are extraordinary women in their fields who will be sharing their journey as they continue to break barriers. First, we have Dr. Nadia Prendergast. She is an assistant professor in York University's Faculty of Health, School of Nursing, and focuses her research on the experiences of internationally educated nurses of color working within Canada's multiculturalism practices. Her interests reside in primary health care, community development, women's health, and equity studies. Up next, I want to introduce Dr. Farah Ahmad, an associate professor in the Faculty of Health, School of Health Policy and Management. As a health service researcher, Dr. Ahmad focuses on the primary care settings, psychosocial health, vulnerable communities, and E-class innovations. Dr. Ahmad examined the health risk assessments through further studies and has now taken the concept to community health centers serving vulnerable communities. Finally, we have Dr. Ruth Rodney, who is an assistant professor in York University's Faculty of Health School of Nursing. Her focus is on understanding health through social, political, economic, and historical realms, with the desire to eliminate health disparities caused by various forms of discrimination. Dr. Rodney has also contributed to advanced higher education for the profession of nursing in the Global South by guest lecturing in Guyana and Ethiopia. Acting as moderators today, we have the inspiring Funmi and the like-minded JS, who are the events managers here at EWIH. They have been diligently working with us on this project from the very beginning, so I would like to pass it on to Funmi.
Thank you so much for that introduction, Robin. That was lovely. And we will now move to the next section on our agenda, which is the panelist discussion. And I am super excited as I cannot wait to hear the responses from our amazing panelists. So I hope everyone has their pen and pencils ready to go because a lot of gems will be dropped. So get ready. Okay, let's dive right into it. So for our first question, I would like to direct it to all of our panelists. We will start with Dr. Nadia, then Dr. Farah, then Dr. Ruth, okay? So first, I would like to ask about your career and education path that led you to where you are today. So Dr. Nadia, you can take it away.
Hi everyone, thanks for the invitation to talk today as part of the panelists, and thank you so much for that wonderful speech that you gave. It was really good. Thank you. So I would like to say how I started was I came into nursing because it was something that was kind of popular, one of the main work to do, and the irony is that my mother, when she left the Caribbean to come to England, so I was born in England, she wanted to be a nurse. And there were so many barriers that she couldn't be one. So it's like I kind of inherited it and came into nursing. But I did realize when I came to Canada that there were also some other barriers that I noticed in nursing. And that led me to go to do further studies to look at the experiences of internationally educated nurses. So that's what led me to do my PhD.
Wonderful. Thank you so much for that. And Dr. Farah, you can continue.
Thank you very much for the opportunity. It's a real pleasure to present some of our experiences here. So I started my professional career in family medicine in Pakistan. And during my clinical work, I was working with women and children of diverse socioeconomic backgrounds. And that was an eye-opener for me. I became very inspired about the living conditions, which we call social determinants of health, and how they impact health of large number of people. So that was my inspiration. I went for master's in public health. And then it was in the US, and I met very friendly Canadians there. And that was my reason, one of the reasons I migrated to Canada. There I started, in a Toronto General Hospital as a research associate. I was working around issues of immigrant women to access primary care, given my interest in vulnerable populations. And my mentors, inspired me to continue my career path. So I completed my doctorate at UFT, and now I'm here in this academia. So my research then, is inspired all those by those life experiences. I'm interested in primary care as I train in area of family medicine. I'm interested in the social determinants of health, access for primary care, immigrant, racialized women, especially. So all of those are now, in my research work, because the passion is really to improve access to care for these vulnerable groups. And in Canada, that we have a universal system, I started to realize that it's not so universal. We have to continue the equity work.
Amazing. Thank you so much, Dr. Farah. And I really love what you said about social determinants of health, because I remember when I first, learned about it, I was mind blown, because I was like, oh, wow, I didn't realize how much these factors actually, affect our health in those ways, and how we even have access to some services as well. So Dr. Ruth, you can take it away.
Hi, everyone. Thank you so much as well for inviting me. This is very well organized, and I loved the beginning. I was trying hard to sit here and not start dancing at the start of the session. So my journey to the point where I am at now, it's very interesting, because I never thought when I started that I would be a professor in a university and doing research. Initially, when I started, I graduated from Ryerson. I got into nursing because I had done a co-op placement in school. And, my aunt, who actually also happens to be a nurse, and similar to Nadia's story, is also from the Caribbean, and ended up going to England to work as a nurse because in the Caribbean, she was told that she wasn't smart enough to be in school, and then ended up working as a nurse. And I always had a great love and respect for her, and knew I wanted to do something in the medical field, but wasn't quite sure. And so once I did a co-op placement in ICU at a hospital in Hamilton, I then decided this is really what I wanted to do, and I decided to get into nursing. And so I actually worked for a number of years in many different fields. And one of the most instrumental trips I had taken was I had worked in Kenya for about a month. I was volunteering there. And it was a nurse who actually had gone back to her home town and decided to create a clinic, which amazingly is now a hospital, and really took a comprehensive view on health. And so when I came back from that trip, I started thinking to myself, man, I went there. It was, really great learning. But what did I really change for people on the ground? If anything, I made myself feel better that I went and volunteered for this period of time. But the social determinants and the structural changes for people's lives were really not going to be changed by me volunteering for about a month. And so that made me start to think a bit more so about all of the experiences that I had working on the front lines and in various fields in nursing. And then I decided to go back and get a master's of science in global health, and to kind of expand to kind of contribute to my clinical experience, but to start understanding health in a broader perspective. And so after I finished my master's, I then decided to go back to work and was trying to think, what can I do? At that time, I was looking at and understanding migrant farm workers in Canada, and understanding kind of the issues around that. And then also understanding that even though I wanted to create this change for migrant farm workers, that the dynamics of power within the healthcare system and within the political system influence who gets the type of care and the type of resources that are necessary. And so a conversation with someone who happened to be the head of global health at the time said, whenever you're ready to do your PhD, come and talk to me. And I thought, well, I'm never going to do a PhD. And so after a while, I ended up actually deciding to start doing a PhD, because I also recognize that in order for us to make the changes that we want to see within our clinical settings, in the day-to-day experiences that we have also as racialized people, you have to have the research. And oftentimes we are not represented in good data that helps to essentially support what we already know goes on. So that's why I decided to do a PhD. And then when I left, I was still a bit resistant to coming into academia. And I had gone back to working full-time in an emergency department, and then decided, no, I need to make the change, because I really enjoy working with the community, but then I also enjoy trying to, again, provide and create the information that's going to help to support changes. So yeah, that's kind of my journey.
Wow, thank you so much. And I feel like that just kind of shows that, life may not go as we plan, but everything kind of just works out at the end. So thank you so much for that. And now to our next question. And this time around, I would like to start with you, Dr. Ruth. And then we'll go ahead to Dr. Farah and then Dr. Nadia. So my question to you all is this. What does it mean to be a health leader? What does that mean to you?
Yeah, so for me, when I think about leadership, I really appreciated some of the points that Dr. Pillai Riddell spoke about, because when I think about leaders and leadership, the people who I consider to be the greatest leaders are never those who have had an easy time. You will always find that leaders that can create and evoke change are those who have had some sort of struggle. And so I always remember that, when things may not be going as great as I would like it to be, that these are the times that help to develop great leadership, because you always want someone who has a strong voice and a calm manner in periods of uncertainty. And I also think that when I think about leadership, a leader is also someone who's able to foster leadership in others. And so recognizing that when you are leading, it's not only about holding that leadership position, but also recognizing that you yourself are a learner, and knowing that, a leader is only as good as the team that works with them. And so oftentimes, when I reflect on my own career, and, who I look to in terms of how I want to come across as a leader is also acknowledging that there's many people that I've learned from that, aren't necessarily in a leadership role, but still provide that leadership quality. And so particularly in healthcare, when we are working multidisciplinary and we're working in teams, it's important to be able to communicate effectively. And yeah, so I think that's kind of how I would think about leadership in healthcare.
Thank you so much. And that just made me think about how, we don't have to get to a leadership position up there before you can call yourself a leader. Every one of us is a leader, and we should start to, walk in that reality and, break down those barriers and just, make the changes that we want to see occur. And now, Dr. Farah, you can take it away.
Thank you for that. And I agree with Dr. Rodney, that the life difficulties are very important in the life of those, leaders, even historically. And, they are very important because they lead to passion with determination. So that's that ingredient is very important, and it comes up in a coherent manner, in my view, through your life difficulties. For me, it was loss of my father at age of 15 years when my mom was very young, and how she turned herself from a complete housewife to 200%, head of the household. So that was an eye-opener for me, and that has always, that is a mirror for me when I am faced with challenges. The question for me is, if she can do it, I can do it too. So life difficulties lead to passion, determination, and then you come across role models. The role models you will find not only in the career pathways, education and jobs and all that, but also in your personal life. So, keep reflecting on those, leaders, I would say, in your life, mentors. They will bring that passion and determination for you. And another important part, I think, for leadership is to be a good listener and be flexible, because you are not a leader if you are not listening to others around you, because you are representing a community, a group of people as a leader, and you are no one if you are not listening to anyone. So that's very important for me.
Thank you so much, Dr. Farah. And your story is so inspiring. It even made me reflect back to what Dr. Rebecca said at the beginning, which was, how like your failures and your losses are kind of like what prepare you the most. So like learn from your failures or life challenges, because you might not be able to control what happens to you in life, but you can control how you respond to that as well, right? And just even looking around you and finding those people that inspires you to be a better leader, be it your mom, your friend, and even, in the career section as well. So thank you so much for that. And Dr. Nadia, you can take it away.
Yeah, thanks very much. I totally agree with both doctors have said. I think for me, when I was thinking about what you just asked, was that we are all leaders, innately leaders. The only thing is that often leaders don't know that they're leaders until people recognize them as leaders, because, as we rightly say, they start to follow them or learn to actually become leaders. And I remember teaching one of my classes, and the first question I asked them was, identify some leaders for me that you know. And they went and they told me all these leaders. And the irony is they were all men. Now, a few weeks later, I went back and I took a list of women that were leaders. And they began to realize that all these women around the world who didn't have anything fussy in life, they lived a simple life, they all had struggles, but they surpassed their struggles, which made them leaders. They left footprints for others to follow in. And when I think of a leader in health, I think of someone who's able to create footprints for people to move on. And they often don't have the title, but they do leave the footprints. And then we say, wow, that's a leader, because we want to step into their footprints. So I believe health has so many leaders, and they don't have to wear the label.
Thank you so much for that. And I hope this inspires everyone out here today that you are all leaders, and with or without the title. So just remember that. And now to our next question, which I would like to direct to Dr. Farah. And, this one I'm very interested to hear your response, because, oftentimes we hear people talk about imposter syndrome. So have you ever second guessed your decisions along your path? And if yes, how did you come to terms with those decisions while overcoming those limiting self-beliefs? Dr. Farah, you can take it away.
When I came to Canada, some of my colleagues and friends, they started to ask me whether I have a plan to take medical equalization programs and go back to my clinical work. But, I didn't, because my heart was in system level changes. That's where my mindset was. So I didn't, change that. So I think, again, I would say your passion counts a lot in your career path. So I didn't had to second guess about my decision in the changes I made, but I had to correct many people the assumption that I took medical equalization exams and I didn't meet the whatever cutoff is, and that's and public health or doctorate is my second choice. That's not the case. So I think in my situation for my career choice, it's a reverse thing. I have to correct people that it's my first choice.
Thank you so much for that insightful answer, Dr. Ahmed. The next question I would like to direct to Dr. Rodney. Since you have experience with the various socioeconomic realms for understanding health as a module, and also your desire to eliminate the health disparities in the forms of various discrimination going on in the field, a question about equity to you. So, why is equitable representation in health leadership so critical?
Yeah, thanks for that question. So I think for a couple reasons. I remember that when I graduated from my master's, as I said, I never thought that I was going to do a PhD. And I remember that when I was in my graduation ceremony, there was a Black woman, and for the life of me, I can't remember her name. But she graduated and she received the title of doctor. And for the first time, even though I had had conversations before with the head of the global health program at UFT, when I saw her graduate, that was the first time that I thought that could be me. And it wasn't something that I realized or fully thought about as a possibility until I saw her. And so I say that to say that sometimes, unconsciously, you don't even realize how great of an impact it can be to see someone who looks like you in a position where you want to be. And then, the other point of that is why it's so critical is because you cannot think about trying to resolve some of the long-standing health issues that we focus on. Particularly, I focus on domestic violence and healthy relationships that are long-standing issues for decades that people have worked on, and assume that somehow you are going to be able to create the solutions without the people who are impacted by the inequity. And so, the representation is vitally important because it means that then you are speaking with people as opposed to speaking for them. And I think that sometimes why we continue to face the challenges that we do in resolving or moving forward in some of the health issues that we have are because we actually don't hear from the people who are impacted. And that's why I think, for myself, as I said, it's been a very organic path, and I was not someone who went from degree to degree to degree. But what that means is that in my role now as a professor and in my role as a researcher, I have that frontline experience and understanding of what the end result is of health and social policies. And so that is what I take into my work to ensure that that representation is important. And that is also why, I often, similar to what Dr. Pillai Riddell said, about looking for those opportunities to have a seat at the table where decisions are being made. Because again, no one can understand my experience better than me. And so when we think about who has the knowledge, I think sometimes we kind of have to give ourselves permission to step away from these labels of who is considered to be the expert and recognize that most people are the expert of their own experiences. And when we have representation in those areas of leadership and where decisions are being made, is when we will actually see the innovation that is necessary to address many of those issues. So that's why I think it's not even a question of whether or not it happens. It's a question of when it happens, because it's definitely necessary.
Thank you so much for that great answer. And I do agree with you that fostering people into speaking for themselves rather than speaking for them on behalf of others, it's really important. And the next question I would like to direct to Dr. Prendergast. Due to your work on research with nurses of color and various academic and career experiences you have faced yourself, have you ever felt barriers in your career due to gender or ethnic background?
Yeah, I would say yes in both situations. When I think back, I'll think of one situations within nursing. So nursing is a gendered profession, so sometimes it's hard to see that you can also get that gendered, and you can get that ethical barriers. With the gendered part, I remember I really realized that there is that queen bee, discrimination among each other. And when I first came to Canada, that's what got me interested into looking at this further. I remember going to do my master's because people were questioning my degree. If I was from England, they didn't question it, but because I was Black, they questioned it. So I said, okay, let me go back and give you Canadian education, your certificates and qualifications. I went back, I did it. And I remember some white nurses from Poland, they were saying to me, they felt discriminated. And they said, Nadia, can you do some research on us too? And I felt that was interesting because there was that queen bee syndrome going on in nursing. As a Black woman, I felt it again on another level. And I remember, working at somewhere, and it was really worked well. I left to do my master's, to do my PhD. And I came back because I needed money. And when I came back to work, management had changed towards me because I was the highest qualified. And what basically happened, they would recognize everybody else, but not me. But there is a silver lining to this. I also saw the beauty of women. And what my colleagues did, they would never let me go further up in positions. But what my colleagues did, one day I came into the office, went to work, and they had decorated my office and said, congratulations. While management didn't speak to me. They recognized everybody else, but they would not recognize my qualifications. So there are barriers. There's gendered barriers within a gendered profession, but there's also racial barriers within a gendered profession.
Thank you for your answer. I do agree that barriers exist due to gender and ethnic backgrounds, and statistics do support it. But also there is a support that you need available around you, as you said, of your colleagues. So there is support, and also if we all take an action together, we can change this.
Yeah.
So next question I would like to direct to Dr. Ahmed. So since you have experience working with vulnerable communities and have dealt with a lot of women and have your research based on psychological health, I would like to ask this question on what are the most effective ways to address barriers that women face, especially in the field of health?
Thank you for asking that question. I think the most important part, in general, would be to ask questions to deconstruct. When you encounter such barriers, and so that's on the general. When you are working, you are pursuing your career path, and you encounter those barriers, try to deconstruct, ask questions, but with respect and patience. So that's very important that the way you ask questions should be respectful, because there could be a misunderstanding, there could be a misjudgment on our own part as well. Being a woman of color, so that's on gender side. And then when we are thinking about the women barriers when they are accessing health, I would say that, at the system level, work, for those broader solutions, because it's hard to, go one-to-one, bring a lot of collaborators in your projects, have a vision and a goal set up. Because when you are working in a collaborative environment, then you have your colleagues, your community partners bringing expertise in different areas. So that's a vision, I have, that you want to address inequities in access to care for women, work in a collaborative model. You cannot be an expert for everything, but you can work with several collaborators in order to have a holistic approach. For women's health, the social context is so important. It's not although WHO has developed this definition several decades ago, health is a physical, mental, and social well-being. The actual the way we operationalize is still not there. The social side gets lost, and for women, that's really important because of their multiple roles. And with the changing environment, we are seeing more and more women in the workplaces, and there is an imbalance sort of created if their other roles are still expected in the same intensity. So gendered roles of women is a challenge. So how do we address their health? It's a very holistic approach. We need social care, health care, a lot of aspects working together along with the awareness of, the uniqueness that women have and the inspiration they have to be successful in their career paths and changing the gendered norms in our society. So a long answer.
Thank you so much for that. And I really like the part where you talked about, just collaboration, because we can all, be at the top, or we can work together because there's strength in unity. So thank you so much for that. And now to my next question, which I would like to direct to Dr. Nadia. So how can the community and healthcare institution promote diversity and equal representation in your leadership boards and within everyday interaction? Because one of our goals for this project is to raise awareness regarding the current disparity in health in terms of leadership and representation. So how can we go about doing that?
I would say that the most important thing is that, as Dr. Rodney says, about being in that position of decision making is important to us. So I say we should first start off with introspection. And if you think of somebody who attends AA, what's the first thing they say? They admit who they are. I am an alcoholic. So therefore, when we're going to go to make decisions, and if we're going to really create community and healthcare to be more diverse, we need to admit, I have these issues. I don't see things through certain lens, and I need to learn. The other thing we need to realize is that it's more than just saying, but it's also to make change, and change is an action. So I do believe in declarations. I believe in statements. They're all good. But we're living in a different generation, and I am so hopeful for the future, because this generation is not just asking for visions and missions, they're asking for outcomes and measurements. And therefore, we need to know that when we go to make those decisions, and if we're going to make change, we need to know that we can show that we have made change. So I believe that we're in the right time to do this, and we have the capabilities, but we have to have a diverse setting on the table, where they can say who they are, introspection, and learn from where they're coming from, and actually show the outcomes by making it measurable that we have made changes in these areas.
Thank you for the answer, Dr. Prendergast. And the next question I would like to direct to Dr. Ahmed. So since you have a lot of leadership experience, whether it be developing the HRA tool or the intervention of using ethnic newspapers to promote breast cancer screening, you have had a lot of leadership experience. So a question about leadership to you is, how can we encourage more women to pursue health leadership positions?
I think two important things come to my mind. First is the, sharing the stories of success, especially, from women, and then women of color, women from racialized communities, because having those role models, in front of you, means that there is a reality which is possible. So that is about, I think we can change the reality, by bringing these new perspectives, sharing the stories of success, and they come, as we were talking about, leaders, they also experience difficulty. So learning from the failures, but hearing from those successful role models, mentors, that how did they overcome the challenges. So that is a key component to engage more women, women of color, from racialized communities, indigenous communities, all of, very important. Without seeing those role models, the goal might be perceived as unimaginable. So we have to put those things out there so that we can dream for it.
Thank you for that great insight, Dr. Ahmed. I do agree that role models play a big role in your life, and they shape your experiences and who you are today. So the next question I would like to direct to Dr. Rodney. So as you have contributed to fostering the next generation of Canadian nurses, what do you think is the biggest challenge for the generation of women behind you?
Yeah, you know what, I've given some thought to this one. So one of the things that I think it could be one of the biggest challenges is that, as Dr. Prendergast just said, I am very hopeful in seeing the generations that are coming after me, particularly because definitely you see that it is not only about speaking, it is about action. And even this event is an example of the amazing work that is coming from the generations after me. I think that one of the biggest challenges is because I see the movement and I see the passion and the drive, is that, one of the challenges is to recognize that it may not actually happen as fast as you want it to. And that even though we have made strides forward, that when you move into certain spaces, those spaces still might be reflective of past views. And so part of it is recognizing that you still, while moving forward, have to acknowledge that not every space that you enter is going to be moving at the same pace that you are, and being aware that, the work that you are entering into doing is a long road. And so, when I think about my conversations with mentors that I've had that have been in women's health since the 70s and 60s, I think about, this journey as a relay. And each generation takes the baton, runs with it for a while, and then passes it on to the next generation. And so some of the work that you might be doing, you may not necessarily see the fruits of your labor, but it means the generation coming after you will. And so, I think that it's sort of recognizing and not getting discouraged if things don't happen as fast as you want it to, but to also kind of take refuge in knowing that there's been many generations of women behind you that have kind of, again, advanced the needle a bit, so that you're able to now do the work that you are going to do. So I would say find ways to kind of protect your energy and to replenish yourself, to recognize that there's times where you are going to have to take rest in the journey to kind of, again, rejuvenate and recharge, and then kind of go back and know that, even though you're working towards this goal, it's not going to be a straight path. It's going to be messy. There's going to be times where it's going to be stagnant. And so you still have to, again, I think as both, the other panelists said, have that vision and have that passion for what you're doing, because that is going to be what's going to help to continue to move you forward. Because I don't think either of the panelists here would say that the journey is easy. So I think that is kind of, if I could think about what the challenge would be, that's how I would describe it for the generations of women that are coming after me.
Indeed. Thank you so much for your answer. I do agree that we need to recognize the obstacles that are in the way while working towards a goal, and patience is key to it. So now that we are heading towards the end of our panel questions, I would like to open this last question to all of the panelists. And it is, if you could only give one piece of advice for your audience to take with them in their lives and help them break barriers and mobilize their own power, what would it be? So we can begin with Dr. Prendergast, followed by Dr. Ahmed and Dr. Rodney.
My last advice for everyone would be, you are a born leader, so that's unquestionable. Now you have to find your own passion, mission, vision, whatever you want to call it, but you have a purpose here that you're going to carry through. And I like the old saying that says, when the student is ready, the teacher will come. I would like to say to you, when you found your passion, your leadership will be unleashed.
Thank you so much, Dr. Prendergast. Dr. Ahmad?
That is very well said. Because I also have the same things on the list that, your passion, determination, persistence, they are the key to, success in life. And you have the skills. Once you know what is the meaningful thing in your life, the core, then you would be working towards it even unconsciously. You will creating your own pathways, and in that creative work that you will do, I would say, be a good listener, and listen to others, observe with flexibility, and ask questions, because that's important. If there is anything that's bothering you, you should not sit quietly. You should ask questions, because over time they can accumulate, and we don't want that negative energy hindering our passion, our creativity in developing those relationships or pathways. So don't sit silently, ask questions.
Thank you for this great advice, Dr. Ahmed. Dr. Rodney?
So I'll leave you with two things. I think the first is, never accept no from someone who's not in a position to tell you yes. You have to give yourselves permission to step outside of what you have been told that you are to do or to be defined as. And so oftentimes we kind of self-sabotage by thinking that we can't do something because somebody told us no, but they really don't have any sort of determination on what we can do. So remember that as women of color, never accept no from someone who's not in a position to tell you yes. And the second piece of advice that I would give, that was told to me by a dear friend, is that haven't you been through enough to know that you're pretty much capable of anything? If you are here, I think one thing that I noticed with all of the women who have spoke today is that we've all had challenges. Dr. Ahmed, I also lost my father before my 15th birthday. And so, I think that many of our paths have been kind of lined with some sort of adversity or challenge. But if you're here, it means that you got through it. And not to say that, it makes it any easier, but you're here and you've gotten through 100% of your toughest days. And that is a really, really good statistic, even though I'm not really about numbers. I more enjoy words for research. So that is what I would just say to you, that, the tough days that you've gotten over, you are capable of doing anything. And it's you that has to make the determination about what you can do, and don't leave that for anyone else to tell you.
Those words were really inspiring. And the key messages we got from all of the answers was: be passionate, be a good listener, ask questions when you need to, do not self-sabotage yourself, and know that you are capable of anything. And those were really encouraging, and also we got to learn from them. So now we would like to ask a few questions that students have asked for you. So one question a student has directed to Dr. Ahmed, but again, all of the panelists can add on to it. So the question says that in what ways can COVID data impact public policies which can eliminate oppression and discrimination that is typically experienced by marginalized groups?
That's a very timely question, and the inequities which already exist in healthcare, health system, they have surfaced more during COVID-19 because the procedures and policies have been developed in such a way that they are not responding to the needs of the equity-seeking groups, the marginalized groups and vulnerable populations. So those now I think it is the right time to question ourselves at the policy level, program system level, that what has gone wrong. Why are we seeing so many inequities? And partially we already know it is the living conditions of the people. Without addressing the social determinants of health, having the baseline determinants addressed, it is hard then to create equitable health at the end. So I think a lot more upstream work is needed, and the way moving forward would be to have more community representation in the decision-making table, and including women who are experiencing during COVID-19, especially so many challenges because of their gendered roles, the childcare, the schooling, working from home, they have been overwhelmed with those roles. So bringing the community voices, women voices to the decision making is very important for upstream changes, because there's a limit how much clinical work can do at the end.
Thank you so much for that response. And
Sorry, we're just looking at the questions that are coming in. I know that we have a couple of them come in, private message and in the general chat. If you want to raise your hand at this point as well, so that Sarah can pick you to unmute yourself, please feel free to do so. For me, take it over with the next question.
thank you so much. So a question we got in the chat section was, please comment on the importance of fostering your inner growth and realness as fundamental for success, beginning with yourself. I hope that question was clear, or if you'd like me to repeat, and I'll just direct to Dr. Farah. So please comment on the importance of fostering your inner growth and wellness as fundamental for success, beginning with yourself.
Inner growth and wellness. Yes, I think that self-care goes hand in hand. As I said, we have this holistic concept of health. We have physical, mental, and social well-being. So our health is means taking care of yourself as well, before thinking about bringing a change in the community. That inner growth is very important. So I would say having a balance between your work, studying, and your self-care is very critical. So that goes without saying. If you are worried, you are stressed out, your decision making, your engagement with your peers, colleagues, your choices, all of that could be impacted. Therefore, I think you want to be a strong leader, Start with yourself, take care of yourself. Then you would see the change that you are making in the community.
Thank you so much for that. And it's something I've actually going to be challenging myself as well, to show up for myself so I can show up better for others. And that way I'm better equipped to create the change I want to make. And either one of our panelists, you can also take it away, Dr. Rodney or Dr. Nadia, if you'd like to also add on to more.
Yeah, I agree with that. And I think, as women, and I can say definitely as a nurse, I have to constantly work on this and redefine what this looks like for me. Because I think for myself, I'm very used to putting everybody first. And I am typically the caregiver. And, I have a type A personality, so I try to sort of always manage everything. And so part of what I find helps me in my own wellness and my own personal growth is remaining connected to many different mentors and being able to speak about and kind of have discussions on things that are bothering me or that I'm curious about. I really do try to read when I have time. I would love to have more time to do that. But I think too, also what I am intentional about, and I think in some ways, because I now have a son, has helped me, is that I definitely stop working, at probably 4:30 or 5 sometimes, to ensure that I'm spending that time with my son and being present, because I recognize that role of a mother, particularly of a Black boy, is my most important role. And so I try to ensure that I don't feel guilty about taking time away from work. And I also do things like yoga and try to exercise to give myself time for myself and not to feel guilty about doing that. And I think that sometimes as women, we often do feel that guilt. And I think that it's a day-to-day, very real process of trying to manage balance and then trying to manage all the responsibilities that come with being a professor and also a mother, and also being a very engaged community member.
Wow, thank you so much for that response. And even the part where you mentioned about how, sometimes feeling guilty for taking time off, it just, it really just made me think back again, like it's not selfish to take time off to care for yourself, because when you are in a good state of health, that's when you are able to show up better wherever you need to show up at. So thank you so much for that response. And Dr. Nadia, you can take it away.
Yeah, I was just going to say also, I think for women, it's just that we have so many different hats that we forget who we are. And I would just say, just to be real, just to be authentic, to be genuine about yourself. And sometimes we have this professional hat and we are not able to actually shine through who our character is because we're living up to everybody's expectation. And I think of two friends I have. One friend, she was born in Ghana and she doesn't know her age. That's what she tells us. I don't really believe her, but she says that they didn't keep certificates. But what she's done, because she doesn't know her age, she's forever young. And sometimes what we do, we put times on things because we've been told menopause, menstrual cycles, all these things that are male, oriented, that we have to behave differently. And what I would say, what I love about her, because she says she doesn't know her age, she's eternally young. She has fun. My other friend, she's passed, rest her, she always had this youthfulness. And I always asked her, how do you keep this youthfulness? She says, I always keep current with time. So I would say, have friends, but not your age, okay? Learn to play with children. They'll keep you young. Have fun. Do not keep life so serious. We've got one life. And if you're going to really outburst this leadership, enjoy people, enjoy life, and have a laugh afterwards. Even when it gets rough, laugh at things. It will always make a big difference. Medicine is the finest, laughter is the best medicine.
Thank you so much for that, Resli. That really resonated with me because sometimes, like being a grown adult, my worry sometimes is just kind of like losing myself. And, because I have this idea like, oh, when you are growing, then you have to be super, serious. And then it's like, I never want to lose that, like, should I say, carefree side. So it's, I guess, more about like balancing it. So thank you so much for that. And I hope everyone has taken so much from what was said today. I have my notes out here and I'm just typing out, I'm like, oh gosh, these were so many gems. So I hope, you all enjoyed our session today. Thank you very much.
I do agree with that. What Fanmi said, that there are a lot of gems being shared over here. So another question from the audience is, being a woman definitely has a specific framework. How do we get over the competing to success, to the rising with the ranks, creating more solidarity between women in healthcare? So I would like to open this question to all of the panelists, and whoever wants to answer can go ahead.
I could start with,
Okay.
I was gonna say that, as all of us were saying that, challenges are there for us to, make us better a person. So if you encounter challenges, then, what you learn from it and how you move forward. When I was planning to go for a doctoral program, I was questioned, why a South Asian immigrant woman with a child wants to give preference to doctoral studies over family. And, this line of questioning was heartbreaking for me, and something it is hard to forget. So how I moved forward from there, that's the key point here. Getting, sharing your experience with your trusted people is the right step to take. I shared it with my friends and my mentors, and and then that their advice with my personal determination and going towards a goal helped me to move forward. So under those challenging times, I think the sharing and looking for advice is the right step to move forward.
Thank you for that, Dr. Ahmed. I do agree. Like, there are points where we need that piece of advice. Sorry, Dr. Prendergast.
Yeah, I would say, just adding on to Dr. Farah's talk, that you define success. Whatever you define success is success for you. And one of the reasons I kind of just have a memory on something, when I was working in the community as a public health nurse, and I was asked to go and visit this young mother, single mother, and she had an attitude, people said, when she came to the clinic. So they asked me to go and visit. I went to visit her, the whole stairs, and I was walking it up. It was smelt of ammonia. It was a mess. And then I entered her apartment, and she had taken things and created, she had the architecture of creating old things, painting it and making it in a state of the art. She was success for me. And when I look back, I think of the song, the lead song for Harriet Tubman, the movie. You must watch it. It's an amazing movie. Stand Up. And in the song, the singer says, "Take my people with me." Success is when we have experienced success, but we take others with us. If we fail to do it, we're not successful, because the aim is that we're working in partnership. And that song meant so much to me. And I think Harriet Tubman is an icon, because she had freedom and she went back to bring others to freedom. So when you feel that you've found success, you go back and you get others, then you have success. And it's because we work as a community.
That's the quality of a true leader.
Yeah, and I agree with both what Dr. Farah and Dr. Nadia said. I think that first it starts with how you define success. And so for me, I have never defined success as competition or moving through the ranks, particularly for the work that I do. So when I think about success for me, it is remaining grounded in the community. It's ensuring that I'm working with the goals and the objectives of what the community is looking for, particularly with the research. And one thing I'll have to say is, I think even coming into academia, there is this sort of idea. The reality is that you kind of have this idea that you should be competing. But even throughout my doctoral degree, that was not the experience that I had. The cohort of women that I started with, we were all incredibly supportive because we were interested in each other's work. And so we supported each other as we moved through the process and actually met, we all keep in contact. And so, I will always send, if I see certain opportunities that I know is from somebody that I was in school with, I will send them opportunities. But I think very much part of how you push back from falling into that is ensuring that you know for yourself what your success is and how it's defined. And so it may not necessarily be that it is related to your in your professional capacity. So, for me, the way I think about when I think about success, it's not necessarily, of course, yes, I want to do well in my career. But for me, because I'm focused on eliminating violence against women, success for me looks at ensuring or improving, the experiences of women who have experienced violence. The other way that I think about success is, ensuring that adolescents don't have the same experiences that, my friends and I did when we were dating, to ensure that those are healthier experiences so that when they become adults, it looks different and feels different, which also helps to improve our community and improve future health outcomes. So I think, again, it's just remembering how you define success, as both my colleagues there said.
Thank you so much for those great answers. And a common theme I observed was fostering yourself and working with the community from all the answers. So the last question from the students that we have is, do you have any advice in dealing with doubt, whether it is from those around you or self-doubt, that feeling of imposter syndrome? So again, this is open to all of you and anyone can answer.
I guess I could start because definitely I think I felt imposter syndrome being in the PhD program. And also, you have to really learn the language of academia. And initially when I started, because I was coming in as a frontline nurse, it was a very steep learning curve. And initially I was not a fan of theories because they seemed very abstract and didn't necessarily relate to what I was seeing on the ground. So I definitely felt imposter syndrome quite a bit, like, how did they let me in? But I think that one of the ways that I dealt with it is from the connection I made with others in the program. And so I don't think, in certain journeys that you take throughout life, somebody can't understand it the way that you can if you're not going through it. And so, for example, within the PhD program, which is where I think I felt my most imposter syndrome, it was really being able to have very frank conversations with my fellow PhD colleagues, and then also coming to the realization that, I don't have to change my language. The way that I show up is exactly the way that I'm meant to be. And this is what also relates to the communities where I do my work. And so, but I will say very honestly, it happens repeatedly, particularly because I think a PhD program it's about intelligence, yes, but it's also about perseverance. So you have to really be used to being told constantly that, this is all right, but do it over, or think about it this way. And so you kind of constantly keep questioning, is this can I do this? Did I write this right? But again, I think it's having those conversations and taking time to step away, take a breath, and then going back to it is what sort of helps to deal with that imposter syndrome and doubt.
Thank you so much for your answer. Dr. Ahmed or Prendergast wants to add anything?
Okay, I'll add to that. Thanks very much, Dr. Ruth. I was going to say that when I came into nursing and when I began to look at racism in nursing, nursing was not ready for it. And because of that, I backed off. I kept myself quiet, was in this wilderness for a long time because I felt I couldn't talk about it. And so I began to develop a lot of doubt. Why did I do this PhD? Why did I go down this area? And I remember then when I started, and I really want to thank York University for employing me. When I came into York, someone came to me and said to me, can you talk on race? And I said, I can't. I had total self-doubt. I'd lost everything. I wanted to hide all my work that I'd done, all my conferences that I'd gone. I didn't want people to know who I was. And someone said to me, can you talk on this? And I said, I can't. And I remember going to my daughter, I love your generation. We've got a future, a wonderful future together. My daughter looked at me and I goes, I can't talk on this. And she looked at me, she goes, you're Black, aren't you? And I went, yeah. So she goes, you can talk about it. And that straight away made me realize, do not doubt yourself. We have a thing that we've built called perfectionism. It doesn't exist. Everybody is imperfect. I don't care how lovely they make you think, they are all imperfect. But the wonderful thing about this journey, don't be afraid of the process. The process is the painful part. You will have self-doubt, but the fact that you tried makes you a hero. If you mess up, so what? Everybody's messed up on the journey. I like what Arthur Ashe says, and this is a sad part of it because when he did get HIV, they said, he said, why me? Then he looked and he said, well, why not me? The fact that you're here, why not you? You can do it. You're the right person for the job. So don't doubt it. You're going to mess up on the way, but we all mess up. But why not you? That's the question. When you get self-doubt, ask yourself, why not me? I'm here for a purpose.
Thank you for those encouraging words. Dr. Ahmed, do you want to add anything?
I think, your examples are excellent. So for me, I mean, it was just reverse many times. So it's the opposite side that, I will, so maybe that's imposter syndrome, or on the other side, coming from the, medical background and then changing to public health and more critical social science perspective, that has been a very fruitful journey for me, for my research, my perspective, and I really enjoyed that. However, I still experience that sometimes people would, jump to make a conclusion that, I'm applying a lens which is different from my current position, my theoretical approach or my understanding. So I think because my career path evolved, I evolved in my theoretical approaches, my understanding. So it's a reverse for me. I have to still, give some, explanations where I am and, stop seeing me in this way. So that's an ongoing challenge for me. And, but I enjoy being at York University because that is a place where this has reduced. People understand a lot more than other universities and places where I worked before coming to this university. So it's also the, the institution the colleagues, the environment, who want to understand that, for me, the core would be community perspective and social justice. And you would see that that thread is present across all different issues I have examined: breast cancer screening, domestic violence, health for mental health issues, and now, disability and children caregiving. My core is still there. It's just that sometimes institutions and colleagues' environments, they can immediately recognize, because that's their grounding, and in other places you would encounter a different audience. And I think that's a learning for me, that be aware who your audiences are.
So much for all your experiences and the advices that you shared with us today. It was an honor to have you all over here, and all the answers were really inspiring, and I'm definitely sure that the students got to learn a lot from it.
I hope you all enjoyed the awesome activities planned by the York International's Global Peer Program, who throughout the creation of this event have been nothing but outstandingly supportive to us. You see, they took a bet on a new initiative, a grassroots organization founded not too long ago, and I think together we made something pretty incredible happen. Now, our dear audience, it's your turn. You see, as our project director revealed earlier, our content team has done an outstanding job in creating a timeline of health leaders of the past, contributors who, through their trailblazing efforts despite often facing discrimination and immense barriers, got us to where we are today. Women like Lady Mary Montagu, without which vaccination would not have become a common practice in Western society, a feat I think we can all agree is crucial to overcoming this pandemic, or, like Tatiana mentioned before, Dr. Roberta Bonde, and so many more, whose profiles you can visit on our website starting from today. Our excellent moderators then allowed us to discuss with an incredible keynote speaker and 3 amazing panelists who are leaders in the field of health today, and whose mere presence in their fields has opened the door for so many of us to step through by showing us that indeed, health can and should be more representative. They've taught us to find our passion, grow from our challenges, ask questions, listen actively, and never accept no from someone in a position that can tell you yes. Even with all these monumental and incredible efforts spearheaded by so many, there's still hidden under disparity in Canadian health. We've completed the first step in gaining a bit more awareness on the issue, but now we have to act. All of us have to take action. As Dr. Rodney so aptly put, it's our turn to participate in this relay race. Well, start warming up, because we got just the thing to get you started. Empowering Women in Health is bringing you the first of its kind initiative that can allow you to take action for our future. We call on the community, you, to submit a photo, drawing, painting, or other visual representation of yourselves with the theme Empowered Women in Health. This submission will be accompanied with a few reflective questions. So if you self-identify as a woman, if you study or work in the field of health regardless of your level, and if you choose to challenge the inequities in Canadian healthcare, we want you to participate. This doesn't fit your profile? That's fine. Just share. We want to make this initiative as all things should be, representative of all different types of educational, cultural, societal, and biological backgrounds, which is why we need as many voices as possible to join in. We don't have it all figured out, but together, we can constantly improve and to make more inclusive, like adding closed captions for future events, thanks to one of our audience members today. In this healthcare project, we will build a mosaic to join the community of Canadian health leaders in a common narrative where past, present, and future women all contribute to the history, progression, and advancement of Canadian health. We call upon you, the community. To show you how this works, you just have to visit the site that's on the screen right now or scan the QR code. And as soon as you're in, you'll be greeted with a type form in which you can submit your visual projects. And be prompted with a few reflective questions. So, that being said, it's your time to take a bet, not only on us, but on your future. You are our future leaders. Together, we have the potential to change the face of Canadian health and health leadership to make it equitable and representative bit by bit. We would like to thank Dr. Pillai Riddell, Dr. Prendergast, Dr. Ahmad, and Dr. Rodney for their insights and leadership and for their involvement in this event. As well, Agents of Change program who have continuously supported and mentored us in this initiative, and without whom none of us would be here today. Thank you. Now, if you enjoyed this event and as part of the health community, we encourage you to follow at Empowering Women in Health on Instagram and Facebook. As raising awareness is crucial to making a change, every month we shed light on a different aspect of health, teaming up with local businesses, asking keynote speakers like our Black History Month, and demonstrating how gender disparities persist in that area. As always, your participation is key. So for today, we would love for you to post a story about something you learned today in this event, remembering to tag us at Empowering Women in Health and at York International Students, as you can see on screen. Now, to end things off, we want to propose a new beginning. By visiting our page, you can submit your input for our Canadian Healthcare Mosaic project. Will you join the narrative? Thank you everyone for coming out to this event.